half of the global population lacks access to basic healthcare services. We see a shortage of medical staff, inequality in resources, and substandard quality of medical services here in this world. Why do these challenges persist?
Unfortunately, we have seen suboptimal support to health systems globally over the years. And with the latest pandemic, the health system became weaker. And the investment that came into the health system was less than what it needed to be able to deliver. We are seeing other pressures that are coming on the health system. One of it is climate change. With climate change, we are seeing changes in epidemiological disease outbreaks. We are seeing more water scarcity, and we are seeing more food insecurity. The other challenge that is facing us is related to the workforce. There is definitely a lack of workforce and to respond and to strengthen the systems. The third challenge is related to the conflicts that we're seeing globally and the wars that are globally erupting. In conflicts and wars, the health system is the first victim. They have to treat more patients, they have to respond more, and they themselves, as healthcare workers, as system, are also suffering from the impact of the war and the conflict.
You mentioned conflict. So the conflict in Gaza is now in its 9th month, and your organization, along with other aid agencies, has warned of the risk of worsening humanitarian situation there. Given the extent of damage in its infrastructure and local people's mental health, what should be done to rebuild that area?
The humanitarian crisis in Gaza is definitely one of the largest we have seen in many, many years. And the dire conditions that we are facing is unfortunately affecting lives of the people in Gaza. The Palestinian Red Crescent Society is the society that currently is responding with UNRWA on the UN side, and they are supporting the people in Gaza since the beginning of the conflict back in October up till now. However, bringing in aid has been a huge challenge. Bringing in medical teams has been a huge challenge. Evacuating medical cases, because the health system in Gaza has weakened over the 9 months and most of it has been destroyed. The level of care requires evacuating medical cases. This has been a huge challenge. What we need to do is we need to bring more aid. We need to work on bringing more support. We need to relieve the medical teams in Gaza. They have been responding for 9 months.
Let's talk about China's role in global health governance. Where should we look at or do more down the road in the form of collaborations between China and IFRC?
China is the second largest economy in the world, and we look at China as a major player. We know in 2014-2015, when the Ebola outbreak happened in West Africa, China was the first international aid that came in and supported in that response. We have seen China's footprint during the COVID pandemic, where the large number of vaccines that were donated by the Chinese government, the medical supplies, the personal protective equipment that helped a lot of countries respond and protect its people. We strongly believe that China's international multilateral approach is integral and core in advancing the global health agenda. IFRC and China government, the partnership started to scale up in the last 2 years. We signed an agreement to support health systems in Lebanon, in Syria, and in Palestine. And few days ago, we signed a memorandum of understanding with SIDCA. And one of the outcomes of that MOU is to eliminate malaria, and we're starting in Gambia. There's a lot together that we can do. For us, we share common priorities on health, and we believe that together we can go to the first and the last mile. The Red Cross, Red Crescent are very well known to reach the last mile where there are no systems, the communities that are left behind. And this is where we see that our strong collaboration is highly needed.
Going forward, where else do we look at when it comes to technology or science or new trends to beef up our capability in healthcare?
there is a shortage of 10 million health workers needed by 2030. This is a huge priority that needs to be worked. Definitely technology, artificial intelligence, digitalization will help shorten the distances between the expertise where they are and where are the needs. And to respond to this 10 million shortage, we definitely need to make use of innovation and technology to help on that agenda. Linked to this, mental health. With technology and advancement, isolation is increasing. People are socially disconnecting physically, but they're more connecting on the network. This has an impact on mental health. And we see that in addition to conflicts and challenges, also the advancements that we're seeing in technology will definitely have an impact on the mental health and well-being of generations. And this is where we are investing in looking into solutions and innovations to address mental health needs.